Hi, everyone. This is Nurse Anna from nursestudy.net. We're going to start this series with acute respiratory distress syndrome, ARDS. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A patient with severe pancreatitis develops acute respiratory distress. Arterial blood gases reveal pH 7.31, PaCO2 52 mm of mercury, PaO2 58 mm of mercury on 100% oxygen by a non-rebreather mask. Which intervention should the nurse anticipate? A. Prepare the patient for intubation and mechanical ventilation. B. Administer intravenous corticosteroids immediately. C. Titrate down oxygen to prevent oxygen toxicity. D. Encourage incentive spirometry and ambulation. Correct answer, A. Rationale: hypoxemia that does not improve with high concentrations of oxygen is characteristic of ARDS. The patient is acidotic with hypercapnia and requires mechanical ventilation. Corticosteroids may be used in some cases but are not the immediate priority. Question 2. Which assessment finding is most consistent with the early stages of ARDS? A. Crackles, frothy sputum, and central cyanosis. B. Refractory hypoxemia and respiratory alkalosis. C. Hypercarbia with bradypnea and somnolence. D. Bilateral infiltrates and hyperresonance on percussion. Correct answer, B. Rationale: early ARDS is marked by refractory hypoxemia and respiratory alkalosis due to increased respiratory rate. Crackles and infiltrates may appear later. Hyperresonance suggests air trapping, not fluid accumulation. Question 3. The nurse is caring for a patient with ARDS on mechanical ventilation. Which ventilator setting is essential in reducing alveolar collapse? A. High tidal volume ventilation. B. Positive end expiratory pressure, PEEP. C. Low FiO2 to prevent oxygen toxicity. D. Synchronized intermittent mandatory ventilation, SIMV. Correct answer, B. Rationale: PEEP helps keep alveoli open and improves oxygenation in ARDS. High tidal volumes can worsen lung injury. While FiO2 is managed to prevent toxicity, PEEP is the key strategy to reduce alveolar collapse. Question 4. Which patient is at highest risk of developing ARDS? A. A 70-year-old with controlled hypertension and history of stroke. B. A 55-year-old postoperative hip replacement patient. C. A 40-year-old septic patient with gram-negative bacteremia. D. A 60-year-old with stable chronic obstructive pulmonary disease, COPD. Correct answer, C. Rationale: sepsis, particularly with gram-negative organisms, is the leading cause of ARDS due to the systemic inflammatory response and capillary leak syndrome that leads to non-cardiogenic pulmonary edema. Question 5. A patient with ARDS is being treated with prone positioning. Which action is a priority for the nurse? A. Administer analgesics to reduce pain from immobility. B. Turn the patient every 2 hours from side to side. C. Monitor for pressure ulcers on the back and occiput. D. Ensure airway patency and monitor for accidental extubation. Correct answer, D. Rationale: prone positioning can improve oxygenation but poses risks like accidental dislodgement of the endotracheal tube. Maintaining airway patency is the highest priority. Question 6. A nurse notices sudden onset of decreased breath sounds and hypotension in a mechanically ventilated ARDS patient. What complication should the nurse suspect? A. Pulmonary embolism. B. Tension pneumothorax. C. Cardiac tamponade. D. Acute kidney injury. Correct answer, B. Rationale: barotrauma from high PEEP in ARDS can lead to tension pneumothorax, which presents with hypotension, decreased breath sounds, and tracheal deviation, if present. It is a life-threatening emergency. Question 7. Which nursing intervention is most appropriate when caring for a patient with ARDS receiving neuromuscular blockade therapy? A. Monitor deep tendon reflexes hourly. B. Perform frequent neurological assessments. C. Ensure adequate sedation and pain control. D. Elevate the head of bed 90 degrees continuously. Correct answer, C. Rationale: neuromuscular blockers paralyze the patient but do not provide sedation or pain relief. Adequate sedation and analgesia must be provided, or the patient may be awake and in pain but unable to communicate. Question 8. Which laboratory result should alert the nurse to worsening ARDS? A. BNP 90. B. PaO2-FiO2 ratio of 180. C. WBC 11,000. D. Serum potassium 4.8 milliequivalent per liter. Correct answer, B. Rationale: a PaO2-FiO2 ratio below 300 suggests ARDS, with less than 200 indicating moderate severity. BNP helps differentiate cardiogenic from non-cardiogenic edema. The other values are within normal or mildly elevated ranges. Question 9. A nurse is providing care to a patient with ARDS who is agitated and attempting to remove their oxygen mask. What is the most appropriate nursing action? A. Apply soft wrist restraints. B. Administer prescribed sedatives and reassess. C. Switch to nasal cannula for comfort. D. Reduce oxygen flow rate to avoid agitation. Correct answer, B. Rationale: agitation may reflect hypoxia or discomfort. Sedation should be administered per order to maintain oxygen therapy and prevent accidental extubation. Restraints are not first line and nasal cannula provides inadequate support. Question 10. Which outcome indicates effective treatment of a patient with ARDS? A. PaO2 of 65 mm of mercury on 100% FiO2. B. Respiratory rate of 32 breaths per minute. C. Absence of bilateral infiltrates on chest X-ray. D. SpO2 of 92% on 40% FiO2. Correct answer, D. Rationale: improvement in oxygenation with lower FiO2 requirements, i.e., SpO2 greater than 90% on less than or equal to 40% FiO2, indicates that gas exchange has improved. A PaO2 of 65 on 100% FiO2 still indicates poor oxygenation. Question 11. A patient in the ICU with ARDS is receiving high levels of PEEP. The nurse notes new onset hypotension and distended neck veins. What is the most appropriate initial nursing action? A. Notify the healthcare provider to decrease the PEEP level. B. Increase IV fluid rate and monitor blood pressure. C. Elevate the head of the bed and administer oxygen. D. Auscultate lung sounds and assess for asymmetry. Correct answer, D. Rationale: high PEEP can cause barotrauma and tension pneumothorax, which presents with hypotension and distended neck veins. Assessing for asymmetrical lung sounds is the first step before notifying the provider. Question 12. The nurse is caring for a patient with ARDS who is intubated and on mechanical ventilation. Which assessment finding requires immediate intervention? A. PaO2 72 mm of mercury on 50% FiO2. B. SpO2 88% on 100% FiO2. C. Fine inspiratory crackles in bilateral lower lobes. D. Respiratory rate of 20 breaths per minute. Correct answer, B. Rationale: SpO2 less than 90% on 100% oxygen indicates refractory hypoxemia, a hallmark of ARDS, and requires immediate action. The other values, while notable, are not emergent. Question 13. Which of the following interventions should the nurse anticipate in the early phase of ARDS? A. Administering loop diuretics to remove alveolar fluid. B. Inserting a chest tube for pleural effusion drainage. C. Implementing lung protective ventilation strategies. D. Preparing the patient for bronchoscopy. Correct answer, C. Rationale: lung protective strategies, including low tidal volume ventilation and moderate PEEP, are key in early ARDS management to prevent ventilator-induced lung injury. Diuretics may be used cautiously but are not first line. Question 14. Which of the following best explains the pathophysiology of ARDS? A. Alveolar overdistension causes pulmonary vasoconstriction. B. Cardiac failure causes hydrostatic pressure in the alveoli. C. Inflammatory mediators increase capillary permeability. D. Bronchoconstriction results in airflow obstruction. Correct answer, C. Rationale: ARDS is caused by a systemic inflammatory response that leads to increased capillary permeability, resulting in non-cardiogenic pulmonary edema and impaired gas exchange. Question 15. A nurse is reviewing the plan of care for a patient with ARDS. Which nursing diagnosis is most appropriate? A. Ineffective airway clearance related to secretions. B. Impaired gas exchange related to alveolar capillary membrane damage. C. Risk for aspiration related to decreased consciousness. D. Activity intolerance related to generalized weakness. Correct answer, B. Rationale: the primary issue in ARDS is impaired gas exchange due to damage to the alveolar capillary membrane, which reduces oxygen diffusion. Question 16. A patient with ARDS is started on IV vasopressors to maintain perfusion. What is the nurse's priority assessment? A. Level of consciousness. B. Peripheral pulses and capillary refill. C. Hourly urine output. D. Breath sounds and chest expansion. Correct answer, C. Rationale: vasopressors may reduce renal perfusion. Monitoring urine output is a critical indicator of end-organ perfusion, especially in critically ill patients. Question 17. Which medication should the nurse question in a patient newly diagnosed with ARDS? A. Methylprednisolone IV. B. Furosemide IV. C. Lorazepam IV push. D. High-dose beta-agonist inhalers. Correct answer, D. Rationale: beta-agonist inhalers may be used cautiously, but high doses are not typically part of ARDS management and can cause tachycardia and increased oxygen demand. The other options may be appropriate depending on the case. Question 18. A patient with ARDS is being weaned off the ventilator. Which parameter indicates readiness for extubation? A. Respiratory rate 10 per minute, PaO2 60 mm of mercury on room air. B. Spontaneous tidal volume 200 milliliters. C. Negative inspiratory force, NIF, of minus 35 cm H2O. D. PaCO2 60 mm of mercury with pH 7.28. Correct answer, C. Rationale: a NIF less than or equal to minus 30 cm H2O indicates adequate inspiratory effort. The other values show hypoventilation or poor respiratory function and suggest the patient is not ready for extubation. Question 19. Which of the following is a late sign of ARDS that should alert the nurse to potential respiratory failure? A. Intercostal retractions. B. Use of accessory muscles. C. Paradoxical breathing. D. Restlessness and anxiety. Correct answer, C. Rationale: paradoxical breathing, chest contracts during inhalation and expands during exhalation, is a late sign of respiratory failure and diaphragmatic fatigue. Restlessness is an early sign. Question 20. A patient with ARDS is on a protocol to rotate them into the prone position. Which outcome indicates that the therapy is effective? A. Increased respiratory rate and dyspnea. B. Decrease in heart rate and blood pressure. C. Improved PaO2-FiO2 ratio. D. Resolution of pulmonary infiltrates on chest X-ray. Correct answer, C. Rationale: the PaO2-FiO2 ratio is the key measurement of oxygenation efficiency. An improvement in this ratio indicates that gas exchange is improving with prone therapy. Question 21. A patient with ARDS is being managed with low tidal volume ventilation, LTVV. What is the primary rationale for this strategy? A. Prevent alveolar hypoventilation. B. Promote surfactant production. C. Reduce ventilator-induced lung injury. D. Improve clearance of pulmonary secretions. Correct answer, C. Rationale: LTVV, e.g., 6 ml per kilogram ideal body weight, is used to minimize barotrauma and volatrauma, preventing further lung injury in ARDS patients. This is a cornerstone of ARDS management. Question 22. A patient in early ARDS presents with respiratory alkalosis on arterial blood gas, ABG. Which finding best explains this imbalance? A. Hypoventilation due to fatigue. B. Increased pulmonary perfusion. C. Rapid, shallow breathing from hypoxia. D. Retention of bicarbonate by the kidneys. Correct answer, C. Rationale: in early ARDS, patients typically hyperventilate in response to hypoxemia, blowing off CO2 and causing respiratory alkalosis. Question 23. Which dietary intervention is most appropriate for a patient in the acute phase of ARDS receiving mechanical ventilation? A. High-fat, low-carbohydrate enteral feeding. B. NPO until extubation is complete. C. High-protein intravenous nutrition only. D. Low-calorie, high-fiber enteral feeding. Correct answer, A. Rationale: in ARDS, low-carb, high-fat nutrition reduces CO2 production, easing the work of breathing. Enteral feeding is preferred unless contraindicated. Question 24. The nurse notes a sudden drop in oxygen saturation from 96% to 85% in a patient with ARDS. Which action should the nurse take first? A. Increase FiO2 on the ventilator. B. Suction the endotracheal tube. C. Call the respiratory therapist. D. Check for equipment disconnection or kinks. Correct answer, D. Rationale: always check the equipment and connections first for possible disconnection or obstruction before taking clinical or pharmacologic actions. Question 25. A nurse is preparing to educate the family of a patient newly diagnosed with ARDS. Which statement is most accurate? A. This condition usually resolves in 24 to 48 hours with antibiotics. B. ARDS is caused by fluid overload in the lungs from heart failure. C. Your loved one's lungs are inflamed and leaking fluid into the air sacs. D. This is a rare genetic condition that's not related to infection. Correct answer, C. Rationale: ARDS is a form of non-cardiogenic pulmonary edema caused by inflammation and increased alveolar capillary permeability, leading to fluid in the alveoli.
Okay, everyone, now we're going to move on to 25 questions regarding tuberculosis with answers and rationales. Good luck.
Question 1. A 47-year-old homeless patient is diagnosed with active pulmonary tuberculosis. The nurse should prioritize which intervention upon hospital admission? A. Initiate airborne isolation precautions immediately. B. Place the patient in a private room with droplet precautions. C. Start empiric antibiotic therapy with broad-spectrum antibiotics. D. Arrange for transfer to a long-term care facility. Correct answer, A. Rationale: airborne precautions are necessary immediately for active TB to prevent transmission. Droplet precautions, B, are insufficient. Broad-spectrum antibiotics, C, are inappropriate for TB, which requires specific antimycobacterial therapy. Transfer, D, is not appropriate before stabilizing and initiating isolation. Question 2. A patient is prescribed isoniazid, rifampin, pyrazinamide, and ethambutol for newly diagnosed TB. What laboratory value should the nurse monitor most closely during treatment? A. Serum potassium. B. Liver function tests. C. White blood cell count. D. Platelet count. Correct answer, B. Rationale: hepatotoxicity is a significant risk with isoniazid, rifampin, and pyrazinamide. Liver function tests must be monitored regularly. Changes in potassium, WBCs, or platelets are not primary concerns with standard TB therapy. Question 3. A patient receiving treatment for TB reports visual changes, including blurred vision and loss of color discrimination. What is the nurse's best initial action? A. Instruct the patient to stop all medications immediately. B. Notify the healthcare provider about potential ethambutol toxicity. C. Document the finding and reassess vision in 24 hours. D. Educate the patient that minor vision changes are a normal side effect. Correct answer, B. Rationale: ethambutol can cause optic neuritis, a serious complication. The healthcare provider should be notified immediately. Stopping all medications without order, A, is outside the RN scope. Vision changes, D, are not minor or expected. Question 4. The nurse is teaching a patient with latent TB infection. Which statement indicates that the patient understands the teaching? A. I can spread TB even though I have no symptoms. B. I must take medications to prevent active TB. C. I will need to be hospitalized until my treatment is complete. D. I will wear a mask at all times while at home. Correct answer, B. Rationale: latent TB is non-infectious but requires treatment to prevent progression to active disease. Hospitalization and masking are not necessary. Latent TB does not involve active transmission. Question 5. A nurse is reviewing sputum culture results for a patient undergoing TB treatment. 3 consecutive morning sputum cultures are negative. What is the appropriate nursing action? A. Discontinue airborne isolation immediately. B. Notify infection control to review for potential clearance of isolation. C. Remove the negative pressure room precautions. D. Extend airborne isolation for an additional 2 weeks. Correct answer, B. Rationale: discontinuation of airborne precautions requires review and approval by infection control or according to institutional policy, even if sputum cultures are negative. Question 6. A patient receiving rifampin for TB reports orange-colored urine and tears. What is the nurse's best response? A. Stop taking the medication and come to the clinic immediately. B. This is an expected side effect of rifampin. C. This may indicate liver failure. D. You are experiencing a medication allergy. Correct answer, B. Rationale: rifampin commonly causes red-orange discoloration of body fluids, which is harmless. It does not indicate allergy or liver failure. Question 7. The nurse is teaching a community group about TB prevention. Which high-risk population should the nurse highlight for targeted TB screening? A. Middle-aged women who smoke. B. Healthcare workers and individuals in correctional facilities. C. Adolescents who have received all childhood vaccinations. D. Office workers with sedentary lifestyles. Correct answer, B. Rationale: TB screening is critical for healthcare workers, prisoners, and others in high-risk congregate settings. Smoking increases lung cancer risk but is less relevant for TB screening. Question 8. A hospitalized patient with active TB is anxious about isolation precautions. What is the best therapeutic nursing response? A. You will only be isolated for a few days. B. Isolation protects others and helps prevent the spread of TB. C. You should not be concerned, this is hospital policy. D. Don't worry, everyone feels this way at first. Correct answer, B. Rationale: the nurse should provide factual, empathetic education about the purpose of isolation to reduce the patient's anxiety. Question 9. A patient with HIV is diagnosed with TB. What is the nurse's priority concern during co-management of these diseases? A. Risk for hepatotoxicity due to combined therapy. B. Risk for bleeding due to platelet suppression. C. Risk for dehydration due to vomiting. D. Risk for antibiotic resistance from single drug therapy. Correct answer, A. Rationale: HIV patients on TB treatment are at higher risk for hepatotoxicity due to multiple drug interactions. Bleeding and dehydration are secondary concerns, multi-drug therapy is already planned to prevent resistance. Question 10. During the initial assessment of a patient with suspected TB, which clinical finding should alert the nurse to the need for immediate airborne isolation? A. Sudden onset of wheezing. B. Productive cough with hemoptysis and night sweats. C. Frequent episodes of vomiting. D. Diffuse rash over the chest and arms. Correct answer, B. Rationale: hemoptysis, night sweats, and a chronic productive cough are hallmark signs of pulmonary TB, requiring immediate airborne precautions to prevent transmission. Question 11. A patient diagnosed with multi-drug resistant tuberculosis, MDR-TB, is starting second-line treatment. What is the nurse's priority action before administering aminoglycosides such as amikacin? A. Assess the patient for signs of hepatotoxicity. B. Check baseline visual acuity. C. Obtain baseline audiometry testing. D. Encourage increased fluid intake before medication. Correct answer, C. Rationale: aminoglycosides can cause ototoxicity, making baseline audiometry essential. Hepatotoxicity, A, is more related to other TB drugs. Visual acuity, B, is monitored for ethambutol, not aminoglycosides. Question 12. While teaching a patient about directly observed therapy, DOT, for TB, the nurse should emphasize which key point? A. DOT increases the risk of medication resistance. B. DOT ensures medication adherence to prevent treatment failure. C. DOT is optional for patients who feel trustworthy. D. DOT eliminates the need for follow-up sputum testing. Correct answer, B. Rationale: DOT is used to ensure adherence and prevent resistance and treatment failure. It does not eliminate the need for clinical follow-up. Question 13. The nurse is caring for a patient undergoing a Mantoux tuberculin skin test, TST. The nurse should instruct the patient to return for reading of the result within what timeframe? A. 6 to 8 hours. B. 12 to 24 hours. C. 48 to 72 hours. D. 96 to 120 hours. Correct answer, C. Rationale: the TST must be read between 48 to 72 hours to be valid. Reading too early or too late may produce inaccurate results. Question 14. A patient with newly diagnosed active TB is concerned about returning to work. What advice should the nurse give? A. You may return to work once you complete 6 months of therapy. B. You can return to work when 3 consecutive sputum smears are negative. C. You can work if you wear a surgical mask at all times. D. You must stay off work indefinitely due to public health risks. Correct answer, B. Rationale: patients with TB may return to work after completing a minimum amount of therapy and obtaining 3 negative sputum smears. Question 15. A patient is prescribed isoniazid for latent TB infection. Which patient statement indicates a need for further teaching? A. I should avoid drinking alcohol while taking this medication. B. I may experience numbness or tingling in my hands and feet. C. I can stop taking the medication once I feel better. D. I need to complete the full course of therapy even if I have no symptoms. Correct answer, C. Rationale: latent TB treatment must be completed entirely, even without symptoms. Stopping early increases the risk of developing active TB. Question 16. The nurse is caring for a patient who has been non-adherent to TB therapy. What is the most appropriate initial nursing intervention? A. Notify public health authorities immediately. B. Assess for barriers to medication adherence. C. Discharge the patient with home health referrals. D. Recommend hospitalization for strict supervision. Correct answer, B. Rationale: the nurse should first assess for barriers such as financial issues, side effects, or misunderstanding before escalating care or involving authorities. Question 17. A patient asks why 4 medications are needed for TB treatment. What is the nurse's best response? A. For medications are needed to cure the disease faster. B. Using multiple drugs helps to prevent the development of drug resistance. C. Each drug treats a different symptom of TB. D. You will only need to take all 4 drugs for 1 week. Correct answer, B. Rationale: multi-drug therapy prevents the development of resistant TB strains. Cure speed and symptom-specific treatment, A and C, are incorrect explanations. Question 18. Which clinical finding in a TB patient would indicate that the infection has likely disseminated beyond the lungs? A. Blood-tinged sputum. B. Clubbing of the fingers. C. Enlarged cervical lymph nodes and hepatosplenomegaly. D. Hyperresonance on percussion. Correct answer, C. Rationale: disseminated, miliary, TB affects organs such as lymph nodes, liver, and spleen. Blood-tinged sputum, A, and hyperresonance, D, are respiratory findings. Question 19. The nurse is reviewing TB medication administration. Which instruction is most important when teaching a patient how to take rifampin? A. Take the medication with food to avoid stomach upset. B. Take rifampin on an empty stomach for maximum absorption. C. Discontinue the medication if you experience nausea. D. Crush the medication and mix it with applesauce if it tastes bad. Correct answer, B. Rationale: rifampin should be taken on an empty stomach to enhance absorption. While nausea can occur, it does not warrant discontinuation without provider guidance. Question 20. A nurse suspects a patient has active TB after exposure in a crowded living environment. Which initial diagnostic test is typically ordered to support a diagnosis of active pulmonary TB? A. Chest X-ray. B. Tuberculin skin test, TST. C. Interferon gamma release assay, IGRA. D. Sputum acid fast bacilli, AFB, smear and culture. Correct answer, D. Rationale: sputum AFB smear and culture is the gold standard for diagnosing active pulmonary TB. Chest X-ray, A, and IGRA, C, can suggest TB but are not definitive without confirming AFB presence. Question 21. A patient with active TB is started on first-line therapy. Which assessment finding should prompt the nurse to notify the healthcare provider immediately? A. Mild fatigue. B. Mild gastrointestinal upset. C. Yellowing of the skin and sclera. D. Red-orange urine. Correct answer, C. Rationale: jaundice, yellowing of skin and eyes, suggests hepatotoxicity, a severe adverse effect requiring immediate provider notification. Fatigue and GI upset are common mild side effects. Red-orange urine is expected with rifampin. Question 22. A nurse is caring for a newly diagnosed TB patient who lives with young children. Which nursing action is most appropriate? A. Recommend immediate placement of the children into foster care. B. Teach the patient that household members need TB screening. C. Advise that no precautions are necessary because children are resilient. D. Suggest the patient wear a mask only when sleeping. Correct answer, B. Rationale: close contacts, especially children, must be screened promptly for TB. Removal from the home is not indicated without evidence of danger, and masks at night only are insufficient. Question 23. A patient asks how TB bacteria primarily spreads from person to person. What is the nurse's best explanation? A. Through direct contact with contaminated objects. B. Through bloodborne exposure. C. Through inhalation of airborne droplets from an infected person. D. Through ingestion of contaminated food or water. Correct answer, C. Rationale: TB is transmitted via airborne particles expelled when a person with active pulmonary TB coughs, sneezes, or speaks. It is not spread by touch, blood, or ingestion. Question 24. The nurse is teaching a patient with TB about infection control at home. Which instruction is most appropriate? A. You must stay isolated at home for the full 6 months of therapy. B. Use disposable plates and utensils at all times. C. Always cover your mouth when coughing and ventilate rooms frequently. D. Take daily antiviral medication in addition to TB drugs to prevent spread. Correct answer, C. Rationale: cough etiquette and good ventilation at home help reduce the risk of household transmission. Disposable utensils and antivirals are unnecessary. Question 25. A patient with TB is prescribed pyrazinamide. Which baseline laboratory value should be monitored closely before starting therapy? A. Serum glucose. B. Serum uric acid. C. Thyroid stimulating hormone, TSH. D. Calcium level. Correct answer, B. Rationale: pyrazinamide can increase uric acid levels, potentially causing gout. Monitoring baseline uric acid is important to detect complications early.